right, I'm going to share my screen. So for those of you that are on your computers, okay. Whoops, going to the end. All right, well, thank you so much for those of you who are joining and those of you who are watching or will watch the recording. My name is Tracy Sullivan. I'm with Resolve, and we're so excited to have you here to learn a little bit more about the Washington State Grassroots Advocacy Training Call. So what is the purpose of this webinar? So I know we included some details in an email that we had sent out to invite you to join us. But the webinar is going to be talking about some advocacy meeting logistics and what meeting with your senator and or representative's office would be like, some talking points and your story. And then we'll also leave plenty of time for questions and answers.
I did not designate,
And if you have any questions throughout, however, there is a chat box feature. You can click on that and type in your question, and we'll be able to read that as well. So if you do have any questions prior to the end, feel free to type those in as we go along.
Okay, so this is Betsy Campbell with Resolve. So why are we meeting with lawmakers? Because as Washington residents, your voices are the most important. It's not Resolve, it's not ASRM, it's not the lobbyist, it's you as the constituent. Your senator or representative is elected to serve you, and it's important for them to know how infertility and family building have impacted you, or in the case of the professionals on the call, how it's impacted your patients or clients. Your stories are what's most impactful in illustrating the lack of access to care for infertility treatment and fertility preservation. Taking the time out of your busy lives to meet with your lawmaker sends a strong message to your lawmaker that you really care about this issue, and therefore they should care about this issue. Next slide, please. So they should care about this issue because the insurance laws in Washington State are not meeting the needs of the family building community. I don't have to tell you that there's no infertility insurance law in the state that covers infertility diagnosis and treatment or fertility preservation for those at risk of medically induced infertility, such as cancer patients. We know that 1 in 8, or about 210,000 women in Washington State have infertility, and approximately 3,800 Washingtonians of reproductive age are diagnosed annually with cancer. And these numbers do not include the LGBTQ plus individuals and couples who also need assisted reproduction technology to build their families. Our ultimate goal is to pass inclusive, pro-family insurance legislation in Washington State. So on that note, I'll turn it over to Abby to talk about the legislative climate in Washington.
It happens to the best of us. I was on mute. This is actually a wonderful time to be having these conversations with your legislators. The legislative session wrapped up on April 25th. So that means that legislators are no longer considering any laws right now or having a lot of meetings in person or virtually in Olympia with committee meetings. They're kind of at the slowest point of their legislative lives right now. Even more fortunately for us this year, legislators are not running for re-election. This is an off year. So many of them are at home in their home districts. They are meeting with constituents like you, and they're starting to set their priorities for the next upcoming legislative session, which is in January of 2022. So when we get to January of 2022, that will be what's considered a short legislative session in Washington. That session will last 60 days, but don't let the short legislative session fool you. A lot gets done within that short 60-day period. So this is really the perfect time for us to start getting legislators a little more familiarized with the issues that we're trying to accomplish, and just to start setting the stage for them to hear from folks who live in their district, who are having these struggles, and letting them know that you're watching, you want to communicate with them, you want to be a resource. So this is really the perfect time for that. Next slide, please. So a little bit about meeting logistics. We will be providing you with an email that is drafted that you can personalize and send in to your legislator, to your senator and your representatives. That will help you ask for the appointment to meet with their office. And right now, I think most legislators are still taking meetings virtually. We are encouraging you to meet with them virtually. And that's completely up to your comfort level if they suggest anything else. But just want to put that out there that most legislators are taking these meetings virtually. They're very well versed at doing so. So even if they say, sure, you can come into the office, if you're more comfortable with a virtual meeting, please just request a virtual meeting. That's absolutely okay, and they will accommodate it. We are hoping that everyone will get some meetings on the schedule between the first week of August, which is just next week, and hopefully meeting through the September 15th timeframe. If a legislative assistant or staff member gets back to you and suggests a meeting at a later time, that's just fine. Please take it. Having a meeting, even if it's a little later, is better than no meeting at all. Some things to consider for your meetings. Meetings are really fairly short. We generally schedule meetings with legislators for around 15 minutes. You might get a meeting for a half hour. That doesn't necessarily mean you have to use that whole half hour. Really what we're trying to do is just make sure that we're getting your story across. So be prepared to be able to deliver that message within that 15 minutes and allow time for the legislator to ask you questions and have a really good conversation with them. So keeping it short, but also heartfelt is really important. Let's see. One other point I did really want to hit is you may not hear back from that legislative assistant right away in order to schedule the meeting. That's okay. They're really busy. They're getting a lot of meeting requests day after day. It's perfectly acceptable to wait a week. If you still haven't heard back from them, reach back out. They're used to getting hounded, usually by lobbyists like me, but they will absolutely be responsive. If you still continue to have issues getting something scheduled with that legislator, contact us and we'll see if we can help. We're here to help. Becca, I'll turn it over to you.
Great. Thanks so much. And this is Becca with ASRM, the American Society for Reproductive Medicine. And I'm going to tell you a little bit about what to expect in those quick 15-minute meetings. First of all, you might be meeting with the representative or the senator themselves, but you also might be meeting with a staff member who's representing that person. Don't be surprised if they look younger or, if they have a different demeanor than you expect. They're representing that office. And so for your purposes, no matter whom you're meeting with that member directly through their staff. The meeting structure, as others have said, it's quick, it flies by. And so you want to be prepared to set the stage by introducing yourselves and the others in the meeting. And magic word here is constituent. Let them know that you're from their home base, that you vote for them and in their district, and even if not for them, and that your story is important to them. And then tell your story, and I'll talk a little more in detail about what that sounds and looks like, particularly at a fast clip, the elevator pitch. But the idea is simply to put a human face to these issues. There are so many things that come across legislators' desks from day to day. You know, you can imagine how many times they're doing 15-minute meetings in a day. The idea is to stand out, and as Abby said, be heartfelt in what you're saying. Share your story in terms of how infertility has impacted you, whether or not you had insurance coverage. And again, we'll talk about that in more detail. But again, just as we said about virtual or in person, share what you're comfortable sharing. That's key. You own your story and you tell it the way that you feel comfortable sharing it. You do want to make the ask. Always make sure to say, can I count on you for your support? They may not be able to answer you on the spot, particularly a staff member. They may say, I'll have to talk to my boss and I'll get back to you. Fantastic. That is your entree to say, can I please make sure that I have your contact information so that we can follow up? You'll likely already have it, but if you don't be shy about asking. They'll pop it in a chat if you're in a Zoom meeting, or can follow up directly with Resolve, and then we'll pass that along to you. But the important thing is that this is not one and done. You will be, as Abby said, establishing a relationship here if you haven't already met with this office. So it's fine to ask for them information. And of course, you do want to be on time because time is precious. Next slide. Great. So telling your story, what does that look like? What does that sound like? I don't know about you, but I could tell my story on end because it has so many different layers. But with 30 seconds or so to go in your elevator pitch, here's what that might sound like from a patient perspective. Hi, my name's Becca O'Connor. I'm one of your constituents, and I'm really glad to be here today to tell you a little bit about my family's story and how infertility has impacted our ability to start a family. Our story, and this is important, you want to contextualize it so that they recognize that you are not just one, you are one of a sea of voices you're representing in that meeting. My story is not unlike others, and let me tell you why. And then you can get into the data points about stats and the number of, I'm one of the 1 in 8. But at the end of the day, just remember that you are setting the stage to say, as much as you're comfortable saying, to tell that person, to connect with them and say, this happened to me. So you need to hear what I'm saying to you because I'm speaking from experience, or I'm speaking on behalf of. And that's where, we'll talk a little bit more on the next slide about how that might shift for a different perspective. For instance, if you're speaking on behalf of a family member. Talking about the cost. Look, that's why we're here, right? We need to hold up a light to the fact that that cost is a massive barrier for so many families and so many Washingtonians trying to begin their families. So to the extent that you can highlight that, that's powerful. And, again, there are buzzwords that really can connect with some of these offices, particularly those that may not connect this as a they issue, right? Like, oh, this happens to other people, but not my concern. Wrong. This is a family building measure. This is pro-family. Talk to them about how infertility is a disease. And in some ways, we're giving them permission to talk about these things in a way that perhaps they haven't before because it seemed like something that only other people deal with. No. This is something that we need to talk about from a public health perspective and think about your audience and resonating with them. Next slide. So, and I'll turn this over to Dr. Herndon in a second to speak from the professional perspective. But again, you heard me speak from a patient perspective. Let's say that you're there representing the fertility preservation side of things, talking about someone with cancer. Again, this is your chance to say, I went through this struggle and this journey, and I was diagnosed with cancer, and unbeknownst to me, that was going to have an immediate and lasting impact on my fertility. And suddenly I was forced to make decisions that I wasn't prepared to make. And upfront costs that I wasn't prepared to meet. And therefore I can't imagine another person going through what my family had to go through. And I'm here on behalf of the others, because even though it may not help me now, I want to make sure that no one else has to go through that struggle. Thinking about it in the global context. If you're a family or friend, you can say, I personally have been impacted, but more importantly, I want you to hear that this is something that the more I talk about it, and I'm sure this will happen to you, Representative, the more I hear from others that it also impacted their family. You may be surprised by that. There's often a disclosure in the course of these conversations from a staff member or from the member themselves to say, actually, my grandchildren were born through IVF, and here's why. Make sure you take note of that, because that's huge and important information for us to follow up on. And make sure that we have a sense of where those personal connections are, because it's powerful again. And turning it to Dr. Herndon now to share how a professional might approach these meetings.
Thank you, Becca. Everyone's voice is important, and as a health professional, you share a really important perspective from the years of treating patients and seeing the impact of infertility and seeing the impact of patients not being able to afford care and not realize their dreams in building families. In terms of the information you share, is to be as straightforward about it, and as be as authentic as possible. And legislators and their staff want to hear from you. So what we'll I'd like to take you through kind of a dialogue between the health professional might approach, just to kind of get a sense of what might be covered. And so to kind of start out, this is good afternoon. My name is Chris Herndon, and I live in Seattle, Washington. I'm Representative so-and-so constituents. I'm a reproductive medicine physician at the University of Washington and part of the Washington Family Building Coalition, Resolve the National Infertility Association, and the American Society for Reproductive Medicine. Thank you for virtually meeting with our group today, and thank you to Representative so-and-so for supporting pro-family legislation. I am here to talk to you today as a health professional in the community and as a patient advocate to support access to infertility medical treatments. Millions of American men and women who want to have children can't. 1 in 8 couples have trouble conceiving or carrying a pregnancy to term. Having children is fundamental for many. It's part of one's identity. Being unable to have a child affects people physically, financially, and emotionally. In Washington state, it is estimated that over 200,000 residents are impacted by the disease of infertility. This is quite a conservative estimate, as it only accounts for women, and those who do not pursue fertility treatments are often not counted. Lack of insurance coverage for infertility medical treatments is the single largest barrier for family building for Washingtonians struggling with infertility today. In addition to heterosexual couples, other persons, including LGBTQ, may require medical assistance to have children. Without insurance coverage for fertility treatment, these Washingtonians face significant barriers to family building. Persons of color also particularly face considerable disparities in access to care and lack of health equity. Insurance coverage has been shown to improve access. Men and women facing a devastating new diagnosis of cancer or other medical condition in which the treatment can render them infertile struggle to afford fertility preservation services. Insurance coverage has been shown to improve access, safety, and outcomes. Insurance coverage improves patients' lives, but has been shown not to significantly raise premiums or administrative costs. The current landscape for insurance coverage for infertility is fortunately changing. As of 2021, 19 states have infertility insurance mandates. Over the past 3 years, 5 states, Colorado, Delaware, New Hampshire, New York, and Utah, have passed legislation. Washington should be the next state to support its residents and to help achieve equity. We asked representatives support for a bill that makes infertility medical treatments covered in the private insurance market, just like any other treatments for a disease. And so in terms of the ask, to summarize it at the end, please help the hundreds of thousands of Washingtonians who face challenges building their families. with the Washington Family Building Coalition, in conjunction with Resolve and National Infertility Association, are exploring the possibility of legislation to make sure treatment of infertility is covered by insurance. If that comes before you, we hope you will remember my story and that of others and will support it. Thank you so much for supporting Washington families. And then you want to close by thanking them, and they will oftentimes they will ask for your contact information and other additional resources so that they know how to reach you. I'd like now to hand the presentation to Abby.
Great. So just some top tips to help your meeting go as smoothly as possible, and to just put this in the right context. A lot of great things have already been said by Becca and Dr. Herndon. Those are great tips for lobbying. And again, your main job in doing this is just to set the stage. You're telling your story. You are contacting your legislator about something that has really impacted you or your family or people you come in close contact with. When you leave their office or you leave their virtual office, the one thing that we want to make sure we have done is left that legislator with a positive impression of you. We want to make sure that when they start to hear about a piece of legislation and they start to think about the meeting that they had with you, they have a good recollection of it, and they want to actually help you. So that's really all your job is, to speak from the heart, to get your story across, and to make sure that they have a good positive memory of your meeting with them. Don't be discouraged if legislators don't know much about this subject. This is the very first time this is coming before the legislature, or is potentially coming before the legislature. They've very likely not had many meetings, if any meetings at all, with anyone talking to them about fertility issues. So if they look a little confused, or they don't have the vocabulary, or they don't have a good understanding of the issue, that's okay. Be patient with them. They're learning. And again, we just want to leave them with that good, positive feeling. If you meet with your legislative assistant rather than the senator or the representative themselves, as Becca said, these are still really important meetings. A lot of times legislators rely very heavily on their legislative staff in order to take copious notes, to take down the story, and let them know how that meeting went. So those meetings are very important. And even if the staff member doesn't ask you a whole lot of questions, or seems just to be writing the entire time, just know that they're doing their job to report back to their boss how that meeting went, where their questions may be, and how the legislator should look at this issue. So that's still a very important meeting, even if it's with that legislative assistant. One thing that I find always helps people is having a way of starting the conversation. A lot of times you can get on the screen and all of a sudden you're waiting for the meeting to start, and you think, what am I going to say when this legislator pops on? And rest assured, legislators are real people too. They're very nice. Think about it. They've put themselves out in front of a community in order to run for public office. They are there to represent you, and they want to hear from you. But I always find that it's really helpful to know that you could always start with a thank you. Thank them for their time. You can also thank them for their service to your community. They dedicate a lot of their time and a lot of hours to leave their hometown, to go over to the capital of Olympia, and to serve and to represent you. So even if you might not agree with the legislators' politics, that's okay too. You can still thank them for their time. The reality is that the issue that's in front of us is not partisan. You know, fertility impacts Republicans and Democrats just the same way. So if you ever start to have a feeling that the conversation is starting to get off track, be sure to bring it right back to what you're there to talk with them about. You're there to talk with them about your story and your concerns around getting this insurance coverage. They're going to expect that. So just make sure that no matter what, if anything starts to get off track a bit, they're going to expect you to bring it back to what you are there to talk with them about. So try to keep it very focused on your story. As Becca said as well, make sure you get a way to follow up with them. You'll probably have their email address and their legislative assistant's email address. Make sure you have it when you leave. And that way you can always be back in touch with them as we start to move through these meetings and through our other steps. We're going to be reaching back out to legislators. I will be meeting with these legislators, and it would be great just to have that ongoing repertoire between you and that legislator. So make sure you have a good way of contacting them. Very important. Take notes on if they have outstanding questions or things that we need to follow back up with them on. If they had a personal experience around infertility, or if they have, have particular concerns that we should know about, please take notes and let us know. That way we can do our best job of following up with them, answering their questions and concerns, getting them more data. And that way we can know who we need to spend a whole lot more time with in order to convince them that this is the right thing to do. So I'll stop right there and throw it back to Betsy.
All right. I think Betsy's on mute. But so to wrap things up, and I apologize, I had forgot the rest of the introductions. So for this webinar, we have Washington Family Building Coalition with Dr. Herndon. We have ASRM with Becca O'Connor, Abby Moore with Abby Moore Public Affairs, and then Betsy and myself with Resolve National Infertility Association. So after this webinar, please watch out for emails from Betsy and myself for some next steps. We talked about that sample email template that you're going to receive, so be on the lookout for that. If you have any questions after this, or you'd like to schedule a practice call before your meeting, we're happy to help out with that. If you want to run through what you're going to say, your story, if you have additional questions on what the meeting's going to be like, please feel free to reach out to us. We're happy to help and hop on the phone or answer any questions that you have. So there is one email we have, provided advocacy@resolve.org, which is a great way to connect. And we will pause for a second. I know that we have covered a lot of information in the last 30 minutes. So if anyone has any questions, please feel free to type them into the chat box so that way we can read them aloud to the group. Or if you're on your phone and you're unable to type in the chat box, you are also welcome to unmute yourself and ask a question. So I will give everyone a moment to see any type-ins. All right, well, I'm not seeing any questions so far, but I'm wondering if perhaps Abby, Becca, and Dr. Herndon can give some last minute advice for meetings. I know you covered a lot already, but maybe one final note of inspiration or thoughts.
Well, I'll just add that even if after all of this prep, you still have questions or concerns, or you're just, not feeling comfortable reaching out to a legislator and talking to them on your own, please don't hesitate to reach out to us, and we can make sure that someone will attend that meeting with you and to help be there in order to answer any questions and just give you someone else to be there with. But as I said previously, there's 147 legislators in Washington state, and I would say 99% of them are the nicest people in the world. They really are, and they're going to love hearing from you. So don't worry too much about having having one of these meetings. I think legislators are going to be very happy to hear from someone in their district who they could potentially change their life with a change to a law.
And I'll complement that, which is spot on, by saying that the word that really resonated with me the most in this conversation was authenticity. Be yourself. You're there meeting with another person. At the end of the day, they're people, they're constituents themselves of others. And so remember that they need to hear from you. They need that education into why this matters. And you have every right and responsibility to be part of this conversation. So feel confident and comfortable stepping into those doors, or virtually.
And I'll just add that truly your story is your superpower. You don't have to be an expert on anything else. You're an expert on your own story. And by sharing it with your lawmaker, you're basically giving voice to everyone who's struggling to build a family. So, and I do think a question came, or a couple came in through the chat, Tracy.
Yes, I did see a question about infertility stats for Washington state. So we will send all of these slides, and on one of the slides there is some information on the numbers in Washington that you can utilize, and we also have some on our website that we can send your way. Again, that Betsy and others have highlighted, your story is definitely most important. So if you don't have all the data and stats, that's okay. You can focus on your story the most. All right. Any final questions before we wrap up?
Can I just say thank you to all of you who are in the process of organizing this, and as someone that was reached out to who experienced infertility and went through all of that process, this isn't going to affect me moving forward, but it will definitely affect the lives of so many women and men and families. And so I just really appreciate that you guys are spearheading this. It means a lot. Thank you.
Thank you.
Yeah, and thank you so much for being here too. All right, well, with that, I think we'll be cognizant of everyone's time and close out. So I will end the recording. Let's see here. And yeah, we will close out. If anyone has